and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of a primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, on Instagram at CHLY A Sound Constitution, all one word, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people with a broadcasting range that overlaps the Cowichan and Sliammon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Welcome to another episode in our series about the health of healthcare. This episode is dedicated to caring for our older adults. I'm your host, Nicole, and joining me are my wonderful co-hosts, Lauren, Lara, and Jamie. Today, we will be discussing healthy living, including maintaining physical, social, and mental capacity as we age to improve our quality of life. We will explore what it means to age in place, also dive into the findings from the longest study on happiness. And later, we will be joined by Sharon Parks, Executive Director of Operations at Providence Living in Comox, for an insightful chat. Stay tuned for this and more. First, here is Lauren with some statistics about our aging population in British Columbia.
Hi listeners, it's Lauren here with statistics. According to the Statistics Canada 2021 census, the population of individuals aged 65 and older in BC made up 20.3% of the population, with 2.4% of the population being aged 85 and older. Here on Vancouver Island, individuals aged 65 and older make up 26.2% of the population, and those 85 and older make up 3.1% of the population. According to a scoping review by Visconti and Niederman, in 2020, 18% of the Canadian population, or about 6.8 million individuals, were over the age of 65 years, with approximately 93% of Canadian older persons residing in private dwellings. By 2030, 23% of the population will be older adults, as life expectancy in Canada is predicted to increase from 84.2 years to 86.2 years. Seniors account for 46% of the national public healthcare expenditures in Canada. According to a retrospective cohort study by Gilcher et al., persons aged 65 and older made up 52.1% of healthcare visits in Ontario. Older age is associated with greater ICU and hospital admittance, longer hospital stays, and higher usage of primary care and specialist services. The same study found that 58.5% of high-resource users presented with 8 or more distinct comorbid conditions, while less than 1% of the cohort had no pre-existing condition. Also, lower socioeconomic status increased the likelihood of being a high-resource user of healthcare, to be prescribed 5 or more medications at one time, and have difficulty affording medications. Social isolation and psychological distress were also shown to be common among high-resource users. The proportion of high-resource users that lived alone was significantly higher than in the general population, at a rate of 34% compared to 25% respectively. Additionally, 22% who reported needing help to care for themselves did not have a close friend or relative that could regularly care for them. Frequent emergency department users comprise 4.5 to 8% of emergency department patients, yet account for 21 to 30% of visits. They incur disproportionately high costs because of high emergency department and other health service use. They also make higher acuity visits and are admitted and die more often than non-frequent users. In a 2021 study by Moe et al., elderly adults with a median age of 77 made up 39.3% of emergency department visits in British Columbia, with 4 to 6 emergency visits per year, were on a median of 8 prescription medications, and had a 24.7% mortality in this study. Despite this, many older adults still have a high quality of life and are aging well. In a 2024 study by Singh et al., researchers found that of the study population of individuals aged 65 years and older residing in Canadian households in 2019 to 2020, approximately 68.7% had perfect health in cognition, 98.5% had perfect health in dexterity, 76.7% had perfect health in emotion, 83.4% had perfect health in hearing, 83.2% had perfect health in mobility, 65.8% had perfect health in pain, 98.5% had perfect health in speech, and 23.7% had perfect health in vision. Thank you for listening to this segment on statistics.
Hi, Lara here. I'm going to share some information with you today about healthy living, with a focus on the importance of maintaining physical, mental, and social activity as we age to promote health and prevent cognitive decline while improving quality of life. Let me start by introducing the concept of social prescription as a holistic approach to healthcare. Recent findings published in the BMC Public Health Journal, submitted by Yedev et al., suggest that people with long-term chronic health conditions often struggle to access and navigate complex health and social services. Social prescription interventions, which are a patient-centered approach, help individuals identify their holistic needs and increase access to non-clinical resources, thus leading to improved health and well-being. That addressing the holistic needs of people with long-term chronic conditions is best done through collaboration and coordination, as well as social prescriptions, as I've just defined, as well as forming community connections and accessing local resources, all of which help to ensure that these social prescription interventions are successful and ultimately lead to improved patient healthcare and well-being outcomes. The study in question revealed that social prescribers can help guide patients with long-term chronic conditions to various local initiatives related to health and social needs. Effective implementation of social prescription interventions relies on building strong relationships between social prescribers and patients, including trust, empathy, and effective communication. A holistic approach to addressing the unmet needs of people with long-term chronic conditions is vital in terms of a successful social prescription intervention. Furthermore, recent findings of Paquette et al., published in the Journal of Medical Research, suggest that a variety of intervention types that address social isolation and loneliness in older adults by either increasing social interactions, providing instrumental support, promoting mental and physical well-being, or providing home and community care are all crucial to increasing well-being and mental health in our senior population. Group-based social activities, support groups with educational elements, recreational activities, and or use of information and communication technologies have been found to be the most effective in improving long-term outcomes. Examples of such intervention types include access to telehealth, recreational activities, and psychological therapy, among others that I've mentioned previously. Now, just to expand on that, I want to tell you a bit about some of the programs that are offered by Nanaimo Family Life Association. For example, Better at Home, which is a program that helps older adults continue living independently in their own homes and remain connected to their communities by providing simple non-medical home support services. This is a provincially funded program managed by United Way and is offered through the Nanaimo Family Life Association and has been for over 8 years. This program serves Nanaimo, Lanceville, Ladysmith, as well as Gabriola Island. Seniors living in any of these communities are eligible to apply. All of the services they offer are designed to suit the individual needs of the client and are delivered by contractors who are carefully screened to ensure professionalism and safety for all clients. The service fees that they offer or they have established are based on a sliding scale with subsidies available for low-income seniors. Offers include light housekeeping, light yard work, and transportation to and from medical and non-medical appointments. Another great program offered by The Nanaimo Family Life Association is their senior peer counseling program, which provides counseling and support to alleviate loneliness and isolation of seniors, both offered in their office and over the phone. It's helpful for promoting healthy aging through physical, emotional, and spiritual well-being. In addition, this program offers speakers for community groups interested in addressing overall healthy aging and emotional wellness, including topics such as power of attorney, prevention of elder abuse, and abuse of prescription drugs and/or alcohol. With their specialized knowledge and experience, they're able to ensure that these information sessions suit your particular needs. There's also the SHINE program, also known as the Seniors Housing Information and Navigation Ease program. The Nanaimo Family Life Association provides information on housing options for seniors, and while they are not a housing provider, nor are they able to provide housing placements, their Seniors Housing Navigator is fantastic in terms of providing information that will help Nanaimo seniors find and maintain safe and appropriate housing. Finally, I want to tell you about the TAPS program offered by the Nanaimo Family Life Association, also known as the Therapeutic Activation Program for Seniors. And this program offers a combination of free social, mental, and physical activation programming for isolated and/or marginalized seniors. The activities that they offer currently include chair yoga classes, exercise groups, as well as a monthly rotation of educational and participatory programming. At this point in time, they are offering a hybrid program, which has a lot of flexibility, considering the majority of their sessions are held through Zoom, with a selection of in-person recreation options as well. So as you can see, even through just that one organization, the Nanaimo Family Life Association here in Nanaimo, we have a variety of options available to us in terms of social services. Thanks so much for listening.
If you are just tuning in, you are listening to A Sound Constitution on CHLY 101.7 FM. Thank you, Lara, for sharing that valuable information on social prescription and the local resources offered by Nanaimo Family Life. Perhaps you'll find some inspiration from this clip by Robert Waldinger, clinical professor of psychiatry and director of the Harvard Study of Adult Development, the longest-running scientific study of adult life ever conducted. Contrary to what many believe, this study reveals what is most important in attaining a good quality of life. Spoiler alert, it's not fame or money.
What keeps us healthy and happy as we go through life? If you were going to invest now in your future best self, where would you put your time and your energy? There was a recent survey of millennials asking them what their most important life goals were. And over 80% said that a major life goal for them was to get rich. And another 50% of those same young adults said that another major life goal was to become famous. And we're constantly told to lean into work, to push harder and achieve more. We're given the impression that these are the things that we need to go after in order to have a good life. Pictures of entire lives, of the choices that people make and how those choices work out for them, those pictures are almost impossible to get. Most of what we know about human life, we know from asking people to remember the past. And as we know, hindsight is anything but 20/20. We forget vast amounts of what happens to us in life, and sometimes memory is downright creative. But what if we could watch entire lives as they unfold through time? What if we could study people from the time that they were teenagers all the way into old age to see what really keeps people happy and healthy? We did that. The Harvard Study of Adult Development may be the longest study of adult life that's ever been done. For 75 years, we've tracked the lives of 724 men. year after year, asking about their work, their home lives, their health, and of course asking all along the way without knowing how their life stories were going to turn out. Studies like this are exceedingly rare. Almost all projects of this kind fall apart within a decade because too many people drop out of the study, or funding for the research dries up, or the researchers get distracted, or they die, and nobody moves the ball further down the field. But through a combination of luck and the persistence of several generations of researchers, this study has survived. About 60 of our original 724 men are still alive, still participating in the study, most of them in their 90s. And we are now beginning to study the more than 2,000 children of these men. And I'm the fourth director of the study. Since 1938, we've tracked the lives of two groups of men. The first group started in the study when they were sophomores at Harvard College. They all finished college during World War II, and then most went off to serve in the war. And the second group that we've followed was a group of boys from Boston's poorest neighborhoods. Boys who were chosen for the study specifically because they were from some of the most troubled and disadvantaged families in the Boston of the 1930s. Most lived in tenements, many without hot and cold running water. When they entered the study, all of these teenagers were interviewed, they were given medical exams. We went to their homes and we interviewed their parents. And then these teenagers grew up into adults who entered all walks of life. They became factory workers and lawyers and bricklayers and doctors, one president of the United States. Some developed alcoholism, a few developed schizophrenia. Some climbed the social ladder from the bottom all the way to the very top, and some made that journey in the opposite direction. The founders of this study would never in their wildest dreams have imagined that I would be standing here today, 75 years later, telling you that the study still continues. Every 2 years, our patient and dedicated research staff calls up our men and asks them if we can send them yet one more set of questions about their lives. Many of the inner city Boston men ask us, "Why do you keep wanting to study me? My life just isn't that interesting." The Harvard men never asked that question. To get the clearest picture of these lives, we don't just send them questionnaires. We interview them in their living rooms. We get their medical records from their doctors. We draw their blood. We scan their brains. We talk to their children. We videotape them talking with their wives about their deepest concerns. And when about a decade ago we finally asked the wives if they would join us as members of the study, many of the women said, "It's about time." So what have we learned? What are the lessons that come from the tens of thousands of pages of information that we've generated on these lives? Well, the lessons aren't about wealth or fame or working harder and harder. The clearest message that we get from this 75-year study is this: good relationships keep us happier and healthier, period. We've learned 3 big lessons about relationships. The first is that social connections are really good for us and that loneliness kills. It turns out that people who are more socially connected to family, to friends, to community are happier, they're physically healthier, and they live longer than people who are less well connected. And the experience of loneliness turns out to be toxic. People who are more isolated than they want to be from others find that they are less happy, their health declines earlier in midlife, their brain functioning declines sooner, and they live shorter lives than people who are not lonely. And the sad fact is that at any given time, more than 1 in 5 Americans will report that they're lonely. And we know that you can be lonely in a crowd and you can be lonely in a marriage. So the second big lesson that we learned is that it's not just the number of friends you have, and it's not whether or not you're in a committed relationship, but it's the quality of your close relationships that matters. It turns out that living in the midst of conflict is really bad for our health. High conflict marriages, for example, without much affection, turn out to be very bad for our health, perhaps worse than getting divorced. And living in the midst of good, warm relationships is protective. Once we had followed our men all the way into their 80s, we wanted to look back at them at midlife and to see if we could predict who was going to grow into a happy, healthy octogenarian and who wasn't. And when we gathered together everything we knew about them at age 50, it wasn't their middle-aged cholesterol levels that predicted how they were going to grow old. It was how satisfied they were in their relationships. The people who were the most satisfied in their relationships at age 50 were the healthiest at age 80. And good, close relationships seem to buffer us from some of the slings and arrows of getting old. Our most happily partnered men and women reported in their 80s that on the days when they had more physical pain, their moods stayed just as happy. But the people who were in unhappy relationships, on the days when they reported more physical pain, it was magnified by more emotional pain. And the third big lesson that we learn about relationships and our health is that good relationships don't just protect our bodies, they protect our brains. It turns out that being in a securely attached relationship to another person in your 80s is protective. That the people who are in relationships where they really feel they can count on the other person in times of need, those people's memories stay sharper longer. And the people in relationships where they feel they really can't count on the other one, those are the people who experience earlier memory decline. And those good relationships, they don't have to be smooth all the time. Some of our octogenarian couples could bicker with each other day in and day out. But as long as they felt that they could really count on the other when the going got tough, those arguments didn't take a toll on their memories. So, this message that good, close relationships are good for our health and well-being, this is wisdom that's as old as the hills. Why is this so hard to get and so easy to ignore? Well, we're human. What we'd really like is a quick fix, something we can get that'll make our lives good and keep them that way. Relationships are messy and they're complicated, and the hard work of tending to family and friends, that's not sexy or glamorous. It's also lifelong. It never ends. The people in our 75-year study who were the happiest in retirement were the people who had actively worked to replace workmates with new playmates. Just like the millennials in that recent survey, many of our men, when they were starting out as young adults, really believed that fame and wealth and high achievement were what they needed to go after to have a good life. But over and over these 75 years, our study has shown that the people who fared the best were the people who leaned into relationships with family, with friends, with community. So what about you? Let's say you're 25, or you're 40, or you're 60. What might leaning into relationships even look like? Well, the possibilities are practically endless. It might be something as simple as replacing screen time with people time, or livening up a stale relationship by doing something new together, long walks or date nights, or reaching out to that family member who you haven't spoken to in years, because those all too common family feuds take a terrible toll on the people who hold the grudges. I'd like to close with a quote from Mark Twain. More than a century ago, he was looking back on his life, and he wrote this: "There isn't time, so brief is life, for bickerings, apologies, heartburnings, callings to account. There is only time for loving, and but an instant, so to speak, for that. The good life is built with good relationships."
If you are just tuning in, you are listening to a Sound Constitution on CHLY 101.7 FM, and that was Robert Waldinger's TED Talk on Harvard Study on Adult Development. He's reminding us that the key to a good quality of life is not about things. Good quality relationships increase our happiness, but also increase our physical health and cognitive health. So lean into and nurture those relationships.
Hello everyone, it's Jamie here, and today I'll be talking about aging in place. This simply means that older adults can continue living in their homes or the communities they know and love for as long as possible. But it's more than just staying in the same physical space. It's about having the freedom to make their own choices, staying connected to what's familiar, and feeling like they belong. For many people, home is not just a place but a source of comfort, stability, and a lifetime of memories. So why does aging in place matter? According to BC Statistics, the government's central agency that provides important data for British Columbia, the number of people over 65 is expected to double by 2041. As more people reach older age, it's essential to think about how to support their independence and quality of life. Research from the Journal of Aging and Health shows that older adults who are able to stay in familiar environments, like their own home or community, experience several key benefits. One of these benefits is a sense of stability and safety. Staying in a place they know well, surrounded by their personal belongings, familiar people, and routines, helps older adults feel more secure and less anxious about changes. Another important factor is maintaining a sense of control. When older adults have the choice to stay in their own homes or communities, they feel more empowered to make decisions about their daily lives. This sense of autonomy can significantly boost their self-esteem and overall well-being. According to the American Psychological Association, feeling in control of their environment helps older adults maintain a positive outlook and sense of dignity, which is crucial for their mental health and happiness. Being in familiar surroundings can also strengthen social connections. Older adults who age in place can continue to interact with their neighbors, participate in community activities, and maintain relationships that have been built over years. This social engagement is vital as it reduces feelings of loneliness and isolation, which are common challenges for many older adults. Research from the Canadian Institute for Health Information shows that strong social connections contribute to better health outcomes, lower rates of depression, and even improve cognitive function among older adults. To support aging in place, British Columbia has several resources and programs. One key resource is BC Home Support Services. This is a government-funded program run by regional health authorities like Island Health, Fraser Health, and Vancouver Coastal Health. These services are designed to help older adults live independently at home. Home support workers assist with things like bathing, dressing, light housekeeping, meal preparation, grocery shopping, and medication reminders. They also help with mobility support, like moving from bed to a wheelchair. People interested in these services can reach out to their regional health authority, where a case manager will assess their needs and set up a plan that works best for them. Another key resource is Better at Home. This program is managed by United Way British Columbia and funded by the Government of BC. It helps older adults stay independent by offering services like transportation to appointments, grocery shopping assistance, light housekeeping, and friendly visits for companionship. They also provide minor home repairs or yard work to keep home safe and comfortable. For example, if an older adult needs help trimming hedges or fixing a broken step on their porch, Better at Home can arrange for somebody to help. Older adults or their families can visit the Better at Home website or contact their local United Way office to learn more. In addition to these well-known programs, BC also offers the BC Seniors Guide, a comprehensive resource that provides information on services, programs, and initiatives to help older adults maintain their health and independence. This guide includes information on housing options, financial benefits, transportation services, and social support programs. It's available online or as a printed copy and is an excellent starting point for older adults and their families to explore what's available. And for those seeking a more social experience, the Seniors Community Connector program connects older adults with local activities, support groups, and community resources. This program focuses on helping seniors stay active and socially engaged, reducing the risk of isolation and loneliness. Older adults can find out more about this program through their regional health authority or local community centers. And BC 211 is another essential resource which provides 24/7 free and confidential information on a wide range of services, including healthcare, housing, and transportation. Older adults and their families can simply call or text 211 or access it online to find the help they need in their community. For legal and advocacy support, Seniors First BC offers legal advice, assistance with elder abuse cases, and educational programs. Seniors First BC is dedicated to ensuring the rights and safety of older adults, especially in situations where they might be vulnerable or at risk. Seniors and their families can contact Seniors First BC by calling their toll-free helpline at 1-866-437-1940 or visiting their website at seniorsfirstbc.ca. The Office of the Seniors Advocate BC also acts as an independent voice for older adults in the province. This office monitors services and issues that affect seniors, providing valuable advice and information while ensuring that their voices are heard and their rights are protected. Seniors can reach the Office of the Seniors Advocate by calling 1-877-952-3181 or visiting their website at seniorsadvocatebc.ca. According to Family Caregivers of BC, a nonprofit organization that supports family caregivers in the province, nearly 1 million British Columbians provide unpaid care to family members, friends, or neighbors. Family Caregivers of BC offers resources like educational workshops on managing stress and legal planning, and one-on-one coaching for personalized support. They also provide respite programs, which give family members a break from their caregiving duties so they can recharge and look after their own well-being. Caregivers can find more information, join programs, or connect with a support coach through the Family Caregivers of BC website or by calling their toll-free helpline. Also, Family Caregivers of BC produces the Caregivers Out Loud podcast, which shares real-life stories and practical advice. The podcast is available on their website and major streaming platforms, helping caregivers feel more connected and supported. While aging in place has many benefits, there are also challenges to consider, especially around home safety and accessibility. Many homes weren't built with aging in mind, which can lead to safety risks. This is where the Home Adaptations for Independence, also known as HAFI, comes in. HAFI is run by BC Housing, a government agency responsible for housing programs across the province. The program provides financial help to low-income seniors and people with disabilities for home modifications like installing grab bars, widening doorways, or adding ramps. These changes make it easier to do everyday activities like using the washroom or getting in and out of the house. People interested can visit the BC Housing website or contact their local office for more information. Another organization helping with these challenges is the Senior Services Society of BC, a nonprofit group focused on housing support and advocacy for older adults. They offer services like housing navigation, temporary shelter, and emergency support for seniors who are at risk of losing their homes. For example, if an older adult is facing eviction or having trouble keeping up with the rent, the Society's housing navigators can help them explore other options or connect them with emergency programs. Seniors or their families can reach out to the Senior Services Society directly through their website or by phone. These services and programs in BC are designed to promote independence and dignity, giving older adults the chance to stay in control of their lives. However, while aging in place is a wonderful option for many, some will require more complex care as they age. And this is where the innovative models of care come in. One example being developed here in BC is Canada's first dementia village. It is called Providence Living at the Views in Comox. This village is based on a model from the Netherlands and focuses on person-centered care and active living. Thank you for listening. It's Jamie. Take care.
Thank you, Jamie, for that informative segment on aging in place. What happens when our loved ones can no longer stay at home and we need to look into alternative levels of care? Up next, we have Sharon Parks, Executive Director of Operations at Providence Living at the Views. Good afternoon, Sharon. Thank you so much for being with us today. Can you please tell us a bit about yourself and your role with Providence Living at the Views?
Oh, hi. My name is Sharon Parks. I'm the Executive Director at Providence Living. My background is I'm a nurse. I've been a nurse for nearly 30 years. And I'm quite new to sort of seniors care and long-term care. I took this role on just over 3 years ago and was given this unique opportunity to help build what we're now referring to is Providence Living at the Views. I was brought on to run the old site, the Views at St. Joseph's, but then to take over and help, I guess, build and project manage this new build, which we now fondly known as Providence Living at the Views. And so I guess it's important to probably start a little bit around Providence Living and who Providence Living are. And so Providence Living was established back in 2017, just as the closing of the old St. Joseph's Hospital in Comox was closing. There was an obvious need as there was still going to be an extended care unit, so the long-term care unit. And people much smarter than me started thinking about what we would do for the views at St. Joseph's and what that would look like in the future. And so a collaboration between Providence Healthcare and St. Joe's Hospital came together, and Providence Living was formed. And so Providence Living started looking after the views. That's from 2017. Providence Living has grown a little bit since then. We have actually, we now have another long-term care facility in Vancouver in the downtown east side. And we also have an assisted living facility in the downtown east side as well. And then recently, in the last few months, there's been a few announcements at the ministry level for work that we're going to be doing with Northern Health in Prince George, Quesnel and Smithers, where we will be building additional long-term care homes up there. And so we're going from just one facility and up to maybe 4 or 5 within the next 5 years, and probably more after that. But yeah, so we're still reasonably small, and that makes us pretty nimble, and has enabled us to really work on the Providence Living at the Views, which is the first of its kind, probably publicly funded dementia-friendly village, definitely in British Columbia. I'm not sure about Canada, but definitely in British Columbia. And so it makes us pretty unique for the work that we're doing. So again, emphasizing that, this is a dementia-friendly village. It's not a dementia village. So it's not just for residents or clients with dementia. It's also, we look after the whole spectrum of anybody that's over 19 years old. We take them if they meet certain criteria for long-term care in British Columbia. But what we've done is designed this building to be very special, to be able to care for people with dementia.
Thank you for clarifying that this is a dementia-friendly village. We see in the media outlets that they've coined this as a dementia village, which can be a little bit misleading. So Providence Living at the Views welcomes seniors with or without dementia, as well as adults over 19 in need of long-term care. Being that this is Canada's first public dementia-friendly village, where did the inspiration come from, and how does this differ from traditional care models?
Dementia-friendly villages are not a new concept. There are different dementia-friendly or dementia villages around the world, and so and there's different philosophies of how to look after dementia residents. And so what we did is we actually have been working with some people called from a home called De Hoogweg, which is in let me get this right. It's just outside Amsterdam in the Netherlands. And so we've been working closely with that team, and they have a dementia village that's been there between 20 and 30 years. So they have a long history of doing this work and doing lots of, I guess, quality cycles to see what works and what doesn't work. And so we have taken the model that they came up with, and we've made it our own, really, and blended it into, what we feel works for British Columbians and people in Canada. And so the big thing about our model, we've called it Home for Us, and that's the name that we've given it. It's a model that looks at moving away from what is known as the institutional model of care to something more of a social relational model. And so what this means is that, probably over 60 years since long-term care came to be what it is now, it's always long-term care homes or facilities have always been either attached to acute care, or sometimes they're old acute care buildings. And so that means that the model that has come out of that, how we care for seniors, is very institutional. It's based on the acute care model. It's very task orientated. It's not really very person or people centered. It's really follows the journey of the staff, what makes it more convenient for the staff. And so if many of you have probably been into long-term care homes, they're often, multi-bed rooms. They're homes with huge, large dining rooms with lots of people talking and eating together, which, creates a certain type of atmosphere, but it's not necessarily an atmosphere that we want our seniors to experience, because it can be very overwhelming for them and cause great stimuli in terms of, and then create behaviors that, we don't really want to have our seniors to have to suffer from, agitation, confusion, sundowning, those sorts of things. And so we've really, we've tried to develop this model on three guiding principles, which every piece of work that we've done, we go back to these guiding principles. And so I'll just read these out for you. So the first one is emotional connections matter most. And so this means about creating a community. about making friends, about feeling like you're at home. The second one is home is not a place, it's a feeling. And so this looks at some of the way we've built the building. We've tried to make things look like it's a home. And I'll go into a little bit more detail later, but we didn't want it to look like an acute care unit. So, for example, we don't have nurses stations. We've taken them away. We have med cards, but we don't want the med cards to be wheeled around. We want it to be something more of an experience. If someone came into your home from the community, they don't bring a great big med cart with them. They might bring a bag with certain things that they're going to use. And so we're trying to create that type of environment. And then the last principle is that residents direct each moment. And so if you think about the way long-term care is structured as it is now, it's structured by what we need to do as healthcare professionals. And so we need to give medications out at a certain time. You need to have your bath at a certain time. You need to have breakfast at a certain time. Oh, and then you might have a dressing that we need to do, and we'll do that at a certain time. And so we've really tried to create this much lower hierarchy or flattened hierarchy where our staff have much more autonomy working with residents about what they want, when they want to do it, rather than us directing those moments. And so that's really where our inspiration came from for this model.
I love that. Mm-hmm. And I think it's so important that care is based on the person, this person-centered approach, rather than the institutionalized model where everything is regimented by, you're right, the medication time, the breakfast time. If you don't get up in time, you're not going to get your breakfast, and having to go in and wake up your patient.
And everyone put to bed by 6 p.m.
So that is convenient for the healthcare workers.
Yeah, because our staffing levels go down. And so we want to ensure that everyone is in bed because that's better for us. And so we actually have done a lot of work looking at early risers and late risers and what does that look like in a house? And, do early risers, should they live together in the same household? Because then they're all getting up at the same time. And so then they have this different sense of community and family than if, you've got everyone getting up early, but one person gets up late, so they never see anybody in the house. And then we can look at how we create activities or, things that for residents to do around what's going on in that individual household. So each household could look slightly different depending on the likes and dislikes and the preferences of those residents and what they want from the day. It looks very different.
This sounds really amazing. And bringing that sense of community is also so important. I was just reading a study that we feature in this episode, the Harvard study of adult development and the importance of community and relationships. And that doesn't end when somebody goes into long-term care, and that continuation of relationships and the benefits it has throughout our life and a good quality of life. And I think this is just fantastic. So thank you for sharing that. And that does answer our question here about how you prioritize the well-being and dignity of residents that live of home. And this is what you call it, a village or community.
Yeah, it's a village and it's a community. And so, one of the things that's really important to me is dignity and respect of our seniors. And I don't think in many homes in the province deliver great, excellent care. But I'm not sure that it's really providing dignity and respect for our residents and letting them make some choices about their life and what they want their life to look like. I think, some of the things that we've really done around community is the new home is actually, it's households, small households with only 12 people living in a household. And the households are around this courtyard, which then has this, it has a destination, which is called Main Street. And so off Main Street, there are certain things that you might expect to find if you went to your own high street. So we have what we call the Wellness Centre, which is where our occupational therapists and our physio, they work out of. And they have much more of a clinic model now, rather than going to someone's house and in the middle of the living room, they start saying, let's perform some exercises because I want to see if you can walk. And so, they actually have an appointment. And so they get dressed, they put their coat on, they go outside, and someone helps them to the Wellness Centre where they then see the physio or the occupational therapist. And in there we have different activities that they can do, different equipment that they can use, as well as just being taught different exercises they can do to maintain their strength. The other thing we have to create the community is we have this big community hall just off Main Street. And this is where a lot of our bigger activities that might traditionally be seen in long-term care would still happen. So I'm thinking about bingo and big movie nights and, different card games, we have different singers that come in and bands come in. So those sort of things happen in the community hall. And then at the heart of that, it's all around a bistro. which is one of the things that we are still trying to get up and running at the moment. But what we hope is this is going to be the heart of the village, and this will be where people can come and have coffee. We actually do have a liquor license, and so if you come with your loved ones and people wanting to have a drink, they can have a drink on the deck and look over the beautiful views that we have here. And so it's trying to create that sense of belonging, and that you don't just live in this one house, this one place with one room and a dining room, that you have a destination somewhere to go where you can meet friends or family and have a different scene. And then in Main Street, we also have our art studio, which is well attended. It's amazing how people want to have time to progress their art skills. And we have an amazing art therapist that comes and works with our residents, but it's also drop in and open for anybody to just come in and use whenever they would like. And then we have some more practical things there. One is our physician's office, and the other one is our hairdresser. So again, you can come and get your hair done at the hairdresser, you book an appointment. And then the other new thing that's very novel is that we have a convenience or a grocery store. And the idea around this is that our residents work with the household and the staff, and the staff and the residents can come down to the grocery store, and they actually pick up the supplies that they're going to take back to the house, and which then in the kitchen that they will actually cook and prepare some of the meals for the staff, for the residents, sorry. And so that's pretty unique, because normally food preparation is always done somewhere else. Mm-hmm. So you don't get that sensory perception that you get of being able to participate in preparing food, smelling food as it's cooking, or even just watching someone else prepare the food and actually then having it delivered to you, and you get to eat it. And so that's really, really important. And you know what? The grocery store is a great place because they come, people connect. I hear that there's lots of gossip and lots of storytelling that happens in there, and so it's a pretty special place as well. So lots going on in that community hall to create, in that community area in Main Street, to create what we want is that sense of community. The other thing that we've done is very different is in the households is the dining area. We have an option for residents if they want to. We have like a harvest table. So there's the ability for 6 to 8 residents to sit together and eat meals together. And so you don't usually see that in the homes that I look after elsewhere in the province. You don't see that. You see residents sometimes sitting by themselves or not even wanting to come into the dining area because they want to sit and eat their meal in their room. And so we try and create that sort of sense of community and being you're part of a household, which I think is really important. And I think the other things that I'm just thinking of other things that help well-being, access to that kitchen. It's open 24 hours a day. Anybody can come in. They can open up the fridge. They can find snacks and drinks and help themselves to food. And again, that's new. Food's restricted to a lot of our seniors who are in homes, and so this gives them that sense of being able to have a little bit of control. If they're hungry or they're thirsty, if they're able to, they can come and help themselves. If not, there's staff available, obviously, to access those things for them. And then the other thing that we thought was really important was being able to offer rooms for couples. And so being able to maintain that sense of relationship with people. And so we have a number of rooms that have an adjoining door. And so couples can stay together, so in the same household, and then their rooms would be next door to each other. And so they find it easy to connect with each other. And, I know in our old building, we did have couples together, but they weren't necessarily really near each other. And so it was kind of hard for them to see each other. So we do have that as an option as well in our new home.
That's really important. It sounds like all of these aspects really help create a sense of normalcy, independence, autonomy, and companionship, all which help people thrive.
Yeah, and I think that's exactly it. That's what we want to create. It's something, people don't want to be in long-term care. This is not their first choice. And so how do we ensure that we are creating an environment that, if it's not where you really want to be, but it actually is the second best thing, because you get the care that you need, good quality care, but you also are in an environment that doesn't feel like you're in a hospital.
That's right.
Yeah.
Mm-hmm. And ensuring safety and freedom. And yeah.
And that's really important. That freedom of movement is very, very important to us. And so, people have access to the outdoors whenever they want, and they have access to the community center whenever they want as well.
That's really lovely. When it comes to families and caregivers, How do you ensure families are involved in the care planning process while respecting the autonomy of the residents? That's a big one because we want to respect.
Yeah. I mean, obviously, there's a piece where you have to respect what the resident would like, but we take a lot of, it takes a lot of effort, but we do integrate the family into the work that we do. And so we have we are starting out what we call household meetings, and this is for residents and families where they can come together and talk about what activities they'd like to see in the household, what changes they'd like to see. We have quite a robust family and resident council where the residents and families are involved in giving us feedback around what they think is working and what they don't think is working. And, in a new building, there's often things that are very different from our old building. And so that's been a great forum for them to be able to voice and for us to hear what they're involved in. And then, we're still under regulation. And so, we still have to have care planning conferences, and we still have to have medication conferences. So those all still happen with the resident and the family member involved. The other things that we do have here is we have a great volunteer program. And so that volunteer program works very closely to try and provide programming and for families to be involved in as well. I think we're very, very fortunate that we have a lot of family here that do want to be involved in their loved one's care. Like the other day I was here and a daughter came in with this huge mixer. And she said, I'm bringing it in because I think it was her grandmother. She says, my grandmother wants to bake some buns. Oh. And so she brought the mixer in and she took it up to the household. And then her and her grandmother made some bread buns. Yeah. And so that's exactly what we want. We want people to be able to be spontaneous and to be able to do the things that they would have done at home. That gives them joy and meaning for their lives. And so it's just one example of that, how it's really important that the families are involved with their loved ones.
It's like a home away from home. How great is it to have that space to be able to do things like that? Make buns.
Exactly. Yeah.
Can you tell us about any innovative programs or therapies offered that help enhance the quality of life of the residents?
Yeah. So we have, I've mentioned that we had we have a really good, robust activity program. And so they do a lot. They organize most of our programming. And so that involves our art therapist, and we have a music therapist, and they both of those ladies that work here are amazing and provide such joy to our residents within the arts. We have a spiritual health practitioner here who also does a lot of one-to-one work with people, but also the group group meetings or group spiritual meetings. So we have a chapel here on the site, and so residents for different faiths meet to celebrate their faiths. And so we have that. We have our new model allows for different programming. What we've tried to do is set it up so it's more along the lines of clubs. And so a bit like more normal that you would sign up for a club. And so we have lots of different clubs. So I'm just thinking that things that go on in the wellness center, different activities, yoga, exercise classes, those sorts of things. And then the other one we have, which is great in the summer, we actually have a bike program where we have volunteers that can take our residents out on bikes around Comox, which is kind of cool. So they sit on this bike and they get biked around Comox.
I'm happy to see that program is still going. That's been happening for some time now, hasn't it?
It has. And, our residents, they love it. They love just being able to feel the wind in their hair and get outside. Yeah. So those are some of the program. And the other thing that we're actually doing is we're working quite closely with the Comox First Nation. We have a sacred space here. And so we're working with them around what activities or programming could happen in that space. They're very open. It's for all of our staff as well as our residents. And then obviously we do have some residents that identify as Indigenous. And so how we can provide programming for them that's special for them and meaningful for them as well.
That's really awesome. I understand you have a childcare on premise as well. Do you ever see intergenerational blending? Are there any activities? Yeah,
that's a good point. We do. So we have actually on site here, we have two childcares. We have one that's new, that's part of our new building, and then we have one that was already here on campus. And so, yes, we do quite a lot of intergenerational where the kindergarten children come in and they go and see the residents in their homes. We also have a little play area in our new outdoor space as well in the courtyard. And so, we do look at intergenerational activities. They stopped a little bit over COVID, but we're just starting them all back up again. So yes, we certainly do.
That's great. I love to hear that. Finally, do you have any advice for families or caregivers navigating care options for their loved ones?
Yeah, I mean, I think really working together as a unit around what you want and what you want to see, because there's so many different types of long-term care homes out there. So having an idea of what you want and what will work best for your loved one or what they would like to see is really, really important. I think obviously visiting the sites. I think when you get here and you do the visit, have questions written down so you know what you want to ask, because it's a big deal. Sometimes you get nervous, you're a bit overwhelmed. So having things written down that you know that you want to ask, so you don't forget. And there is a lot of information online. So the Seniors Advocate website does have a lot of information around the homes, different homes all the homes in the province, and so it does give you some information around rooms, whether they're single rooms, double rooms, what sort of activities they provide, those sorts of things. And so there is some information online. And each home will have information online too. So go online and have a look and see what they're offering, and if it resonates with you, and if it's something that you'd like your loved one or you'd like to experience. But sometimes I think it's a bit of a feeling and a vibe when you walk into a place. And so that's, and I don't think there are many people that don't do a site visit, but yes, definitely, I would say the site visit, coming prepared with questions, is really, really important.
Very good advice. Thank you for sharing that. And thank you so much for sharing your insight and wisdom today, Sharon. We really appreciate you being here, for taking the time to talk. And
well, thank you for inviting me. I thought, it's such a pleasure to be able to talk about this. And so if it helps just one person, then
it's really neat to see the other side of the way things are, because it can be so disheartening to, see one way and not always agree with that way, and know that there are other ways, and that hopefully this is the future of healthcare for our older adults. And I think
so. I think people are watching us. Really, other homes, other affiliates, other health authorities across the province are watching. And we have even been asked to go and speak to people in Saskatchewan and in Toronto. So people are watching what's happening here. We do have a research project underway as well. So we've got a 5-year research project with UBC and looking at the quality of life and whether it changes through this transition. And so we're hoping that the research is going to show that this type of care is better for our seniors, that it provides respect, dignity, and an improved quality of life for them. So definitely people are watching, and fingers crossed. But it's a pretty special place when you walk in here. You do feel it, and the feedback from staff and families and from residents has been amazing so far. And we've only been open 12 weeks or 13 weeks, so we're still early days.
Well, you're making a big impact even in that short time. You're doing great work, and here's hoping. Yeah, impact is huge. I'm sure it will be.
Thank you, Nicole.
Thanks so much, Sharon. If you were just tuning in, you were listening to A Sound Constitution here on CHLY 101.7 FM, and that was an interview with Sharon Parks, Executive Director of Operations at Providence Living at The Views. Thank you again, Sharon, for a wonderfully insightful discussion. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY A Sound Constitution, or if you've missed parts of this episode or would like to listen to this episode or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you all next week.